Alrighty, we're going to get started today. We are going to be focusing on the needles and syringes PowerPoint. Again, this is a relatively short lecture for this morning. I'm going to be going through this. This will help you, especially in lab, when you're having to identify needles and syringes, and when and how to know to select the correct one. So again, I'll be going over kind of basic guidelines and for the selection process, given your specific amount. So when looking at syringes, we have various of different sizes depending on the volume that's needed and as well as our intended use. So we have anywhere from down here, we're starting at our smallest. This is our 1 ml. We have then our 3. It moves up to 5, but sometimes it can also go down to 6. There's like a 5 and 6 one, depending on what manufacturer you order it from. Then we bump up to the next size, which is either a 10 or a 12, and same thing. It depends on the manufacturer you order it from, but it's usually around 10 or 12. Then the bigger, bumping up into bigger sizes, we have 20 cc's. Then we have 35. There's not one in this picture, but we do have a 35. And then the largest that is carried is 60. Now, if you work in large animal medicine, they actually do make a 100 and 200 cc syringe because we're working with horses, livestock. These animals are 1,000 to 2,000 pounds. We have to use significantly more medication. But for a small animal, these are your basic syringes that you'll be working with. Now, of course, we're going to size it according to our patient. So if we're, just using an amount that's under 1 ml, we're going to want to stay with that 1 ml. Same thing. We only want to bump it up a size when we need to. But also to be aware, when you pull this plunger all the way back, so this 1 ml, yes, it can hold 1 ml of solution that's drawn up into it. However, when the plunger is pulled back that far, it can actually feel really unstable or be really uncomfortable in your hands when giving. So you might actually want to bump it up to a size 3 if you have a full ml or like 0.9, really close to a full ml, just because when you pull the plunger all the way down to the bottom, it will feel and can feel very uneasy. So when you guys are in lab session, I know we are canceled until February, but when you guys get back into lab, you'll be able to work with needles and syringes and injections, and you're going to see what is a better fit for you. I personally, my go-to is a 3 cc if I can. I'm not a fan of 6 cc's, but if I can fit it in a 3, that's my go-to. Now, when we are selecting the appropriate syringe, we always want to try to get that smallest syringe size as possible. But again, kind of based on your procedure, we will choose different types of syringes, as well as the different tips of these syringes. So we don't just have syringes that are fit for injections like these, that a needle, most of these are luer lock, except for the last 2, these are slip tip. So luer lock means that the needle actually will lock into place on the syringe. Slip tip, it does not. It just pushes into the needle or into the syringe. So there is more risk and factor that we could accidentally poke ourselves or someone else. So we have to be careful when uncapping those needles. So again, with looking back at these different tips based on the procedure, and I'm going to show you guys a picture so you get a visual of what these tips look like. So our regular tip syringe, these are also known as the slip tip. So regular, it doesn't have anything that's going to lock it into place. We use this commonly for like blood draws or administering medications. Same with luer lock. Luer lock is also used for blood draws and administering meds, but I like luer lock a lot better because the needle actually will twist and lock into place on your syringe, and you don't have as much margin for error, especially when uncapping your needle like you do with a regular syringe. It does not securely hold it onto there. Now, we also have eccentric syringes. They're not commonly used. I would say maybe if you are in a specialty center, or especially working with like integrative medicine or rehab, things like that, where we're going to be administering like a lot of subcutaneous injections, you may come into contact with eccentric syringes. Their tip is actually all the way to the side. So it kind of helps with angling when you're giving sub-Q fluids. It's kind of preference. Some people like them, some people don't. Now, our catheter tip syringe, The name is misleading. We do not use this for catheters at all, not for any IV catheter. We can use it for a urinary catheter when flushing it with saline, but a catheter tip syringe is actually a syringe with a very large tip at the end. And the hole is also significantly larger to use for force feeding or tube feeding, as well as oral medications. So if we're grinding up, let's say we need to powderize the tablets and make it into, for horses, we love to take all the tablets, grind them up and mix it with applesauce and put it into one of these catheter tip syringes to give. So more common in large medicine where you're gonna see the catheter tip syringes used for oral medications, but we use them all the time. If we have to place a feeding tube in our patient, our catheter syringe is what we're going to go for. We also have a curved tip syringe. We really only use the curved tip. They're also known as monojects. We only really use them when we're flushing out wounds. They are a 12 cc size syringe, although they're not going to have the measurements on there. And they have a long curved tip at the end. Again, the next slide, I'm going to show you a visual so you guys know what I'm talking about. And we primarily use it when flushing out wounds or abscess. There's really not much more of a purpose than that. Also, you can cut the tip, the curved tip, you can cut it to make it the hole a little bit larger, and you could also use it for oral medications. Last syringe that we have on here is our insulin syringe. And of course, in the name, it gives it away exactly what it does. We are using this syringe. It's actually a syringe and needle combo. It's put together already. And this is used only for insulin administration. And it will also measure in different increments. So instead of cc or ml, like your regular syringes, insulin syringes measure in units. So you could be giving 5 units of insulin, 10, 20, 50, whatever the RX is. So know that insulin syringes are always measured in units. It is no longer cc or ml. And that's really only for insulin. So to give you a visual of what these different tips look like, so we have our regular tip there on the left-hand side. As you can see, it's the same as that slip tip. So there's nothing secure here holding it in like that lure lock. So when you place the needle on top, you're actually going to twist it on, apply some pressure. But when uncapping the needle, you have to hold on to the needle with your thumb or your hand while you're uncapping to make sure that the whole needle doesn't come off when you're trying to uncap, because people definitely will poke themselves when trying to do that if you're not uncapping it correctly. Now our lure lock, that's the next one. I love lure lock. It's got this little extra barrier that's down here. This is what the needle is going to screw into. So it's going to screw on into this lure lock and it will stay in place. It's not going anywhere. So I definitely tend to side with the lure locks, but if all the manufacturer has is a regular tip, we're going to use it anyways. It works the same. It's just a little bit higher risk using the regular. Now the eccentric, like I said, the tip here is actually located off to one of the far sides. So it's not directly in the center like a regular tip is, it's off to the side. And that's mainly just for giving subcutaneous fluids and injections. And it's not used very much. It's kind of a preference thing. You'll see it more commonly in integrative medicine, rehab, things like that, where the patients may need a lot of sub-Q fluids. Then the catheter tip syringe, as you guys can see, the tip is so large, it's huge. You could not fit a needle on this tip. It is only made for feeding tubes or oral medication administration. And then the Toomey, I know we didn't really go off over that in the last one, but the Toomey, we use this for certain urinary catheters or feeding tubes, really not largely manufactured. We like to use the catheter tips instead because we can put them on a multitude of different sizes of the tubes. So looking kind of in a little bit further detail of our lure lock here. So we can see the lure lock syringe has this extra plastic layer here, and that's what the needle is going to screw into and keep it secure in place. And we can see this is a 5 ml syringe because the measurement goes all the way down to 5. Now, this is an example of our catheter tip syringe. Again, just getting a closer look here. So they do manufacture catheter tips all the way down to 1 cc's or larger, just depending on the size of your medication, size of your patient. And you'll notice if we ever send home these syringes, especially if they're pre-filled already with medications, which sometimes we'll do, we'll put a cap on the top of it for all oral medications so that it doesn't seep out. It's going to stay in that syringe. So the cap kind of takes place of that needle when we're using oral syringes. So catheter tips are oral only. This is a visual of the curved tip catheter, or sorry, the curved tip syringes. And again, Monoject, this is the brand that commonly makes them. They usually have no measurements on them. As you can see on these ones, it's pretty rare, but there are up to 12 cc measurements on there. Usually you're going to see it plain like this, where there is no measurements. And again, because we don't really need to know, we're just flushing out wounds and abscesses with these syringes. They're not really being used for specific medications or anything where we really need to know the measurement for. And with these, what I was saying earlier is you could actually take some scissors and cut off the tip here, and then it'll make that hole a little bit larger, and you could use it for oral administration too if you ran out of catheter tip syringes. So when we're looking at how to read our syringe amount, so when we're pulling up medication in our syringes, it's really important to note, you're going to be looking at this image over here on the left. The one on the right, this is for a glass syringe, which really you're not going to deal with much unless you are in like livestock or equine medicine. We use glass syringes sometimes when we're replacing central lines, or ER. You could definitely see them in ER. So, but looking at here over on the left, this is just a regular plastic syringe, and the plunger is going to have two main kind of like marker lines here, and you always want to measure it from the one that's closest to the top. So all of this area in here is air. So you don't want to read this. You want to read all the way to this line, because now this is all of our suspension that you just drew up. So if you read the measurement back here as like 3.1, or sorry, these are tick marks of 2, 3.2, that would be incorrect. The measurement on the syringe is, let's see, 2.2, 2.4. That is the actual measurement. So always make sure that you're measuring from the top of the plunger, not the bottom. And when you are pulling up medications, we want to, of course, keep our needle sterile, and we want to avoid touching the plunger back here as well. Now with our glass syringe, they don't have the double kind of rubber stopper here that you see on the plastic syringes. It's going to be just like a dull end to the end of that plunger. So you don't really have to worry about, which line do I read from? It's a lot clearer. Again, with the glass syringes, you're not going to be dealing with them very much. They usually come in like catheter kits or central line kits. Of course, with it being glass, there is huge risk of dropping it, shattering glass everywhere. So not ideal for veterinary medicine, especially because our patients are so squirmy and they're animals. So you may or may not see. But as you can see with the glass, it's a lot clearer to see your measurement on there. Now, to give you a better visual, when we're pulling up these medications, this is an insulin syringe. And so as you can see on the bottom, it says units. So these are not cc or mLs, this is units because it's insulin. So right now, they have pulled up 50 units of insulin. I can see that it's right at that big line mark, and I know that this is 40, the one below it, even though it's all blacked out, I know that the number below the 40 is going to be 50. So right now I see that this is at 50 units. But same with this syringe, just like the one back here, it has 2 rubber stoppers. And you want to read the one that is the closest to your needle. So I'm going to read this one that's up here. Again, it's at the 50. I'm not going to read the other rubber stopper that's down here at the 60 mark, because all of this area here is just air. That's incorrect. So you want to read from the top right here. Now, when we're counting how many cc's or how much amount we need to have in our syringe, it's really important that before you even pull up your medication, that you look at these increments that are on the syringe. So I can see that this is a 5 cc syringe because it goes up to 5. Now, in between the 1 and 0, there is 1, 2, 3, 4, 5 tick marks. So that means that I'm going to take 1 cc and divide it by 5. 1 cc divided by 5 is 0.2. So every single one of these tick marks is 0.2. Now, if I didn't do that, I might count it as if it's going up by 1, and that would be incorrect. So before you even draw up any suspension, any fluids in your syringe, I recommend look at the syringe, count how many tick marks there are up to the 1, divide the number that you counted by 1 cc. It will tell you how much the measurements is per each tick mark. It's going to make it a lot simpler because it's not the same for every syringe. For 1 cc's, it goes up by marks of 0.01. 3 cc's go up by 0.01. 5 cc's go up by 0.2. So it kind of just depends on the size of syringe that you're working with, and the manufacturer might be different too. So just, again, look at how much you have here, count them up until the 1 cc, divide it by that 1 cc mark. It'll tell you how much, again, this increment and steps, how many value of are those lines. And looking here to see how much medication is in the syringe. So we know that it's all the way down here. We can see the top of the plunger lines up right above the 5. So we're reading this top line here, not the bottom. Again, this is air right here, so I don't care about that. I only care about what's up top. This is all my suspension. So going down here, I can see that it's past the 4. So it's at 4, 4.2, 4.4, 4.6, 4.8. So that is how they got their answer of 4.8. Again, we're not counting this second plunger. That's all air. Now we're going to look at it again. Just a different example. So this is a 3 cc syringe. So like I was saying, the increments are different. So if I count, we have 1, 2, 3, 4, 5. We have 5 tick marks for a half of a cc. So that means that each one of these tick lines is 0.1. Now that's different from our 6 cc. Remember, the tick marks were 0.2. So very important, we're counting those, calculating that before even drawing up those amounts, because you could definitely over or underdose a patient if you're not completely confident in the measurement of your syringe. So again, this guy has that little kind of double plunger there, but we're reading this top line. So if I'm going to read this medication, I know that it's past the half cc, so I can start at half cc. And I know every increment is 0.1. So this is 0.5, 0.6, 0.7. So that is how I got my total amount there. And again, it does double check me here. It does say, yes, you are correct. It is 0.7. Now looking at, this is actually a half cc syringe. So not very common will we see these manufactured. I'm sure if you work with like neonates, so that's like preemies, puppies and kittens, or if you work for a rescue, you might see these because you're dealing with patients that are in infancy. So we can see that the syringe is, again, and they let us know it's a half cc syringe. We can tell by the measurements that that is the last measurement on the bottom, which is 0.5, which also means half of a cc or ml. Remember, you guys, cc's and mls are the same measurement. So we have 0.06 ml of medication, and how you could figure out again those tick marks is I'm going to count every single one up until the full 1 mark and then divide it. So, and it actually tells us here that each tick mark is 0.01. So as you can see, that's a really small measurement. And then each large one will also tell you kind of like when you're getting to bigger measurements on there. So again, just be aware, count up your increments and measurements on your syringe before pulling out the suspension. And if you have a question, like, please ask somebody. They will show you, especially if it's a syringe you haven't seen before. But you will be practicing all of this in lab. We have all of this, all of the injection supplies in lab. So when we get back in there, you guys will be getting a lot of hands-on experience with that. Okay, taking a look at our insulin syringes here real quick. So we have two different types of insulin syringes in veterinary medicine. We use U40 and U100. So that is talking about how many units are within the bottle that we're using. So for U100, it's usually Prozinc. That's the brand of insulin that we'll use. And for U100, it's Vetsolin or Lantus. And it's going to clearly say it on those insulin bottles. I'm going to show you in these next two pictures on how you can identify what type of syringe you need to be using. And again, it's going to line up with your bottle. So both of these syringes, they're both technically half a cc, although one is U40, one is U100. So you can see it's pulling back in units. So the U40 only goes to 20 units. This U100 only goes down to 50. Now these insulin syringes, they can be up to a cc. They do make larger sizes because we have larger patients. And the needle size here is 29. So that is a incredibly tiny needle. We usually work with needles up to size 26. For regular injection use. But because insulin is a medication that's going to be given once or twice daily for the rest of that patient's life, we want to try to minimize, just the effect that that constant poking will have on them. So the size 29 gauge, they usually don't even feel it, or if they do, it just feels like a little bug bite. It's nothing that's traumatic for them. A lot of the times the owners will do the insulin injections while they're feeding their patients. So while they're eating their breakfast, they'll kind of pull up at the scruff because it's going to go sub-Q. All insulin is sub-Q, you guys. Know that moving forward, all insulin is a subcutaneous injection. It does not go in the muscle. It does not go in the vein. It is subcutaneous only. So you can actually pull up kind of at the scruff, rough area where there's a lot of extra skin, and we usually tell them to give it there. And because the patients are eating, they're distracted. Most of the time, they don't even know. Now, when looking at how do I know what syringe to use with what insulin, this is Lantus. Lantus is commonly used with kitty cats. We do use it with dogs, but more commonly with cats. And as you can see here on the box and on the bottle, it clearly says 100 units per ml. So when you see U100 or U40, that's talking about how many units are in 1 ml of this insulin. Now, this is a 10 ml vial. And again, so because it says that 100 units per ml, we just have to match that up with the syringe. So the syringe over here, it says U100 insulin. So as long as we match up U100 with our syringe, U100 with our bottle, we're good to go. Now, it does say it on the bottle as well for subcutaneous injection only. So it will tell you on the bottle how to give this injection and how long this injection is good for. Lantus is actually one of the only insulins that does not have to be refrigerated. It's really awesome like that, but it's only good for 28 days. So if you have a really small patient, it might not be that cost effective for you, but if you have a large patient, it can be better. So give or take, it's a pretty cool brand because again, it does not require refrigeration. Now, when we have our U40, this is primarily with Prozinc insulin, and Prozinc is actually a human insulin, but we do use it a lot in dogs. So you can see over on the bottle here, it says 40 units per ml, and it also says it down on the actual bottle, 40 units per ml. So that means it's a U40. So going over to our syringe, we're just going to double check. It says U40 insulin syringe over here. Now we know, yep, that is the correct syringe to use with this bottle. All right, and then just to give you guys another diagram of our needle and syringe setup, looking a little bit closely. So when I'm talking about all of these terms here, the plunger, I'm referring to this mechanism down here that will push fluid in and out of the syringe. The barrel is characterized as the entire syringe body here. The tip is the little tip of the syringe here. Again, that could be a lure lock, that could be a slip tip, regular. There's a lot of different that we went over earlier. The hub of the needle, if you ever hear me referencing to the hub, that is the base of the needle that connects to the tip of the syringe. Then going up from the hub, you have the body of the needle. And then right at the end of the needle, it's kind of like the eye of the needle. It's called the bevel. So whenever we're giving injections, we want to make sure that the bevel is facing upwards when we are going into our patient, especially when we're doing blood draws so that we're not splicing through the vein. So it's going to look like a little eye looking back at you. All right, and this will be the last slide in this PowerPoint, just going over some different needle sizes. Most commonly, we're going to be using 25 and 22. Those are the most common for small animal sizes when we're giving injections or doing blood draws. Now, if we do have to give subcutaneous fluids, which is fluids under the skin, we could be giving, if this is a large dog, we could be giving 500 cc's under the skin. So we don't want to use a little baby needle for that because it's going to take forever. We'll actually bump it up to around an 18 or a 20, depending on the size of the patient. So when we give subcutaneous fluids, we'll use larger needles to do that. And of course, kind of depending for our patient, whether it's dog or cat, I might decide to go with a larger versus smaller. Rule of thumb is you always want to use smaller needles for cats because they are smaller and they're also extremely hypersensitive. So using those 25 needles as much as possible, 22 if you absolutely need to, and then only moving into size 20 and 18 when we're doing subcutaneous fluids or needing a larger needle for, let's say it's a thicker solution. Sometimes these injectable solutions like penicillin is extremely thick. So you actually have to have at least a size 20 just to pull it out of the bottle. So some of them we have to use larger, but we like to use smaller if we can. You will notice that the larger the number actually means the smaller the needle. So size 25 is a very tiny needle. Size 18, although the number is smaller, the needle is significantly larger. So if you have it's kind of runs the same way as like piercings. So the smaller the number, the bigger the size it is. Same thing with needles. All right, guys, and that is it for the needles and syringes PowerPoint there.